All right, I think we're going to go ahead and get started so that we can give as much time as we can for our presenters today. So good evening, everyone. Thank you so much for joining day 2 of our Public Health Student Organization BenU Annual Public Health Conference, our first one. We're really excited about it. We had a great first day yesterday. I hope some of you were able to join us yesterday as well. Today, of course, is our second day, and today we are going to be focusing on public health internships and careers, and we have some great presenters today who will be, talking to us. So we have our first presentation, first presentations from our Academic and Career Enrichment Center. We will have a presentation on resumes, cover letters, networking, and job searching, which I'm sure many of you are very, very interested in. So I'm very excited for that presentation. And then we have our MPH Alumni Panel. We have 4 panelists who are former alumni of our program, and they have graciously agreed to come and share their experiences, in the field with us. So we're really excited about that. So thank you all so much for joining. We have dropped the agenda for today into the chat. We'll probably drop that a couple more times as folks join as well. And so, you can look through that. That'll have the schedule of what's happening today. And with that, I'm going to pass it to Maria to introduce our first presentation.
Thank you. Thank you everyone for being here this evening. Our first presentation is by Lee Cruz, and he is part of our Academic and Career Enrichment Center here at Benedictine University. So I'll hand the mic over to him. Thank you for being here, Lee.
Thank you much. Well, good evening, everybody. We really appreciate the opportunity to meet with you this evening. My name is Lee Cruz. I've been working for the university for this is only my second year, but I've been working in career services for 23 years and have even presented at national presentations and had some of my information presented in national publications. So I come from a wealth of experience, and today I'm going to address the topics of resume, cover letter, job search, and networking. Typically, when I do this presentation, it takes me well over an hour. I'm going to try to compress it down to about 20 minutes. So I'm really just going to touch on some key items on each of these topics. I'm also going to make these slides available for your group so you can review them after today. And I also ask that you hold off your questions until I'm done with all 4 topics. And then I'm also going to be present for the panel presentation. So if you want to talk to me after they're done with their piece, I'm more than willing to stick around and address your questions then. So just let me, like I said, kind of rush through these topics. I'm going to be talking like an auctioneer. I'm going to be flipping through this pretty quickly. It's just the nature of the beast. I'm trying to truncate a lot of information, compress a lot of information into a short. So let me get started. And so I also on these slides have my contact information. So if you ever want to contact me to have a one-on-one conversation about any of these topics, I'm available year-round, including during the summer months. So I'm always accessible. Our contact information for our department is on these slides as well. All right. So I just want to touch on some key items regarding resume. And these are based on a lot of the conversations I've had with public health students. So one of the questions I'm often asked, is it okay if I go on to a second page of my resume? For this profession, absolutely, it's okay. If you do have a multiple page resume, the thing you want to kind of keep in mind is you want to have those most valuable, pertinent selling points on that first page ideally. You don't want anything that's going to help market you effectively drop onto that second page. So you're trying to kind of front load those key pertinent selling points those on the first page if you have a 2-page. Then I want to talk about integrating a couple of items onto your resume. One is the idea of adding a summary to begin your resume, and that essentially encompasses your experience, kind of your core competencies that are pertinent to the field of public health and health in general, as well as maybe some of those soft skills that are important for any career field that are valuable for this as well. The idea of maybe adding 3 to 10 courses that you've completed for your MPH program onto your resume, the idea of maybe adding 3 to 5 projects that you've completed for your MPH program onto your resume, And then something that's maybe not necessarily related to public health, but the idea in your job descriptions of incorporating into them some numerical items that showcase either what you're accountable for or what you've achieved. I'm going to pull up those samples real quickly here. And I'm not going to read through all of these, but I have a couple of samples of some summaries and some course highlights. So the summary. So here we have healthcare professional with experience as a nursing assistant, medical office assistant, so that what their experience is. Strong foundation of knowledge in patient relations, health assessment, medical terminology, and epidemiology. So those are things that are more kind of core competencies that would be valuable that they've cultivated through their work experience and maybe through their academics that are pertinent to public health. And then in background entails extensively applying interpersonal communication, organizational, analytical, and problem solving. Those are some of those soft skills that are valuable for any career field, but that would be really valuable in a role in public health. I'm not going to read through the second one, but I'll make that available to you. Course highlights. So this is just a listing of 3 to 10 courses that you completed for your program. Just the course title. So you don't have to worry about listing what grade you got or the course number or description or anything like that. And so you'll see in this first sampling, maybe you're interested in pursuing a role that has a scientific element to it, a research element to it, a biological element to it. So you see we have courses on there like epidemiology, biological aspects of public health, biostatistics, methods of research in public. That second sampling of course highlights, maybe you're more interested in working on the business end or the administrative end, managerial end of working in public health. So we have things like public health system, health policy, marketing and public health, the business of health. So those are some course highlights you might think about onto your resume. Project highlights. So what this is maybe listing 3 to 5 projects that you've completed for your MPH coursework. And these are opportunities for you to showcase A, some of your competency for the field, and B, some of your passion for it. And so these are maybe those projects that you had to do for the class that maybe were worth a good percentage of your grade for the course, that really requires you to really dig in and consume a lot of your time and critical thinking skills to put that project together, maybe something you're particularly proud of, a research paper you did, or some simulated program that you did, et cetera. So I'll just kind of give you the first couple of examples here. So what you do is you put the title of the course that you completed the project for, and then a quick, specific overview of what it entailed. Behavioral and social aspects of public health. Conducted a study on alcohol abuse in farming communities, including its prevalence, special issues it presents, and reasons it is challenging to curb on those premises. Marketing of public health. Created a communication plan for informing the public about a measles outbreak in a community and measures that were in place to diminish its spread. So it's again just maybe some projects that you think that you really are particularly proud of that showcase kind of your competency for this field and show that you're really passionate about certain topics related. And then finally, the other item, which again isn't necessarily related to public health, but it's always a good idea in your job descriptions. You don't have to have a massive amounts of this, but if you can at least incorporate 1 or 2 of these items into each of your position descriptions, especially your most current positions, is trying to integrate numbers to show what you're responsible for or what you've achieved. So in here it says, lead weekly individual counseling sessions for a caseload of 25 to 30 adolescent clients, so on and so forth. They show that they're accountable for a caseload of 25 to 30 clients per week. Second one, manage manufacturing operations for a shift comprised of 10 employees, producing an average of $50,000 worth of widgets. They show that they're responsible, accountable for a staff of 10 and their work performance, and that the whole operations kind of entail a cost or revenue of $50,000 per day in merchandise. And the final one is kind of an achievement. Served on a 5-member fundraising team that solicited $7,500 worth of donations, funds, and materials to refurbish the facility's waiting room. So again, we're integrating numbers in there to show either what you're accountable for or what you've achieved. That's resume. Those are the key points I wanted to kind of mention about that. You're always trying to really shape your resume and your cover letter for the types of opportunities you want to pursue. Because again, I know a number of you might not have a whole lot of kind of relevant pertinent experience. You want to have something more than just one line that says you're earning your Master of Public. Have some additional items that showcase some of what you kind of have to offer in relation to competencies in that field and showing your passion for that. So I want to next delve into cover letter. So again, now cover letter, you do always want to relegate it to one page. And what you don't want to do is you don't want to do a simple rehash of what's everything that's on your resume. And that's a common flaw that job seekers make, is they basically summarize their resume and their cover letter. What you want to try to do is you want to try to demonstrate that you've actually read that job description or the internship description, and then you talk about some things that you have in your background that have helped prepare you to actually perform the tasks that they're asking you to perform in that position, as well as trying to talk about how you have demonstrated that you meet some of the qualifications, some of the skills, competencies that they're looking for, and then maybe even integrating into their rationale for why you want to pursue a career in public health now. I'm going to pull up that sample real quickly. Again, I'm not going to read this entire thing to you. So this is an actual internship description that was recently out there. It's for public health epidemiology data analyst internship. And I highlighted in blue here some of the key tasks and competencies that they're looking for in these candidate qualifications they're looking for. So they say they're going to be basically compiling and analyzing data sets and putting together reports based on that data, and maybe even presenting these findings to key stakeholders. They're going to be doing, and talk frequently in here about doing data analysis and regression analysis and surveillance reports, et cetera. And some of the kind of qualifications or competencies that they're looking for is somebody who's really skilled at statistics and utilizing SAS software, as well as things like good communication skills, organizational skills, attention to detail, somebody who is culturally competent. The sample that we have in here, and I'm not going to read the entire letter to you, I'm going to kind of cut to the core of it, is you don't want to simply on your cover letter, again, you don't want to just reiterate your resume. You also don't want to just in a real kind of bland, flat way say, well, I'm a great communicator, I have good organizational skills, I have a sharp attention to detail, and I know all about statistics. You've got to be able to back that up with evidence. You've got to kind of demonstrate how you've actually utilized that competency or where you've demonstrated that particular skill or quality that they're looking for. So in here it says, my academic program has included coursework in biostatistics and research methods, which we have frequently applied SAS software to conduct statistical analyses for various health studies. So here they're talking about that SAS software in which they actually utilized. And then in the next couple of lines, additionally, in my role as a dietary aide at an assisted living facility, I teamed with a dietitian to compile aggregate data on the residents' menu selections each month. We analyze that data to determine certain trends and to identify areas of concern. We develop suggestions for addressing those concerns. We even combine the information from all those reports to develop an annual presentation that we conducted for all staff at the facility. So if we recall, in the job description, it said you're going to be compiling data and you're going to be analyzing that data. And you're going to be producing reports from that data. You might even be presenting your findings to key stakeholders. And in essence, that's what we say here in this particular cover letter example that they did when they were working as a dietary aide. And then kind of just flipping down to this next paragraph here, here's where we talk about the rationale for why you want to pursue public health now. And you want to stay away from real generic phrasing like saying, well, I just wanted to help people. Because if you wanted to help people, you could have been a social worker, or you could have been a teacher, you could have been a mental health counselor, whatever. There's all kinds of occupations where you can help people. So why specifically public health? In this case, they say I'm passionate about public health because I have a keen interest in contributing efforts to programs that educate the greater community on health issues and on measures that can be executed to prevent those issues. So that's what you're trying to encompass in that. I'm going to flip now to talking about job searching. Okay. So really, there's kind of these four main avenues for conducting your job search. You can certainly look through job listing sites, the big ones like Indeed and Career Builder and Monster, et cetera. That's fine. Targeted outreach is something you might think about as well. And that means going online and doing a search for organizations in your community or wherever you're willing to commute to see organizations that provide any sort of public health services, be it healthcare facilities or social service agencies or government agencies, et cetera. And the reason why you might want to do that is that some of these organizations almost never post their opportunities on those big boards like Indeed and Monster, Career Builder. So the only place they're posting them sometimes is on their own individual webpage. So that's why you maybe want to do some targeted outreach who has some opportunities in communities that you're willing to work in. Job fairs are another avenue to consider. And the thing to remember about job fairs is ultimately they're not hiring events. They're more or less networking events, is what we want to get into next, talking about networking. And so it's just kind of having the right approach when you go to a job fair, as though you are networking, not necessarily interviewing for a job at a job fair. So let's talk about networking. So just some basics about networking. So ultimately in networking, what you're trying to do is you're trying to build connections with professionals in your field of interest. You're trying to establish a presence in the field of public health. You're trying to kind of establish a presence in the industry, in the field, trying to almost get your name known within organizations before you even apply for positions in there. And part of that is trying to build these connections with people who are already working in the industry, people who are working in the profession, in the types of occupations you're doing. Part of doing the preparation for that, as you try to introduce yourself to those individuals, is having an elevator speech that you prepare, that you present as you meet these individuals. And essentially, an elevator speech is very similar to writing your summary on your resume, where you're quickly giving a snapshot in like 30 to 60 seconds of what kind of experience you have to offer, and what kind of core competencies you've cultivated through those experiences, and trying to relay now the types of opportunities you're interested in. The other thing to remember about networking too, is you don't want it to always seem like you're just desperately looking for a job or an internship. So it's got to start with almost kind of conducting this kind of informational interviewing, where you're asking these professionals, how did you get interested in this field? How did you get started? What do you find rewarding and compelling about it? What do you find challenging about it? And then what's made you successful at it? And what do you recommend that I do to gain some experience? Do you have any opportunities at your organization? Do you know some other organizations? Is there somebody else maybe I should be talking to? Those types of things. So it wants to eventually evolve into asking about opportunities, but you don't want to start with that. You got to start with kind of building those professional relationships through like doing some informational interviewing. So there are different avenues for doing networking. The first, I call this kind of three-tiered system. There's formal networking, there's informal networking, and kind of in between, which is semi-formal or quasi-formal, whatever you want to call it. Formal networking is ultimately looking at organizations that are hosting networking events. So it might be a professional organization, a health organization, or something along those lines. Or it might be a local chamber of commerce for some local township, something like that is hosting a networking event. The informal networking, you can network anywhere you're at. And so if you're at the park, if you're at the store, if you're at a restaurant, I've had experiences where individuals have networked with me, total strangers. One time I was sitting at a high school basketball game and a couple was sitting next to me, and first started with a conversation talking about the game, and then it evolved into talking to me about what I do, et cetera. And even though they were not interested in working in education, they were more looking at opportunities in accounting and finance. I was still able to engage them in a conversation and say, okay, I know some people who work in specific fields that you guys are talking about that you might have an interesting conversation with. We had an exchange of information, of contact information, and from there it evolved into the husband of the couple eventually landed a position because I introduced him to somebody who introduced him to somebody else. So you can network anywhere. There have been a number of occasions where I've been sitting in Dunkin' Donuts or Starbucks or Panera, where I've had a college student approach me and said, hey, Mrs. Smith just picked up her coffee there at the counter. She's my neighbor. She said I should talk to you because I'm interested in pursuing a career as a speech language pathologist or as a nurse. And said that you might know something about that field or be able to connect me with people. So you can really network anywhere. And then kind of in between formal and informal is this kind of semi-formal or quasi-formal way of networking. But one thing is you can maybe participate in attend presentations. Now, I know everything's being done online right now, but you still might have those opportunities to do some networking by even attending those types of presentations. And that means if you ever look in your local healthcare organization, social service agencies, community colleges, four-year colleges, your local libraries, your local community centers. They all have a calendar of events, and sometimes you will see that somebody is doing a presentation on some topic related to public health. And so now you know you have an expert, number one, and somebody who's passionate about their field. And so it's a good idea to maybe attend those presentations and then introduce yourself to the center afterward. I had a student I worked with several years ago. She was particularly interested in a couple of aspects of health that she was passionate about. One was like smoking cessation. The other one was about diabetes management. And so she was going to all these different organizations. And this was back when we were doing everything in person, of course, but she was going to see these presentations and introducing herself to these presenters who were more than willing to kind of help her and be a quality network contact for them. For her to lead her to opportunities. So she actually wound up taking on some internship and other type of volunteer experiences through those people that she met. And then there would also be sometimes even audience members who would be there who were also representing the profession, who were just interested in the presentation or who were there to support their colleague. So she made multiple connections sometimes at one event. So presentations are one thing. And then the other thing to think about is utilizing some of these online resources like LinkedIn and the BenU network. And the BenU network is essentially just like LinkedIn, except it's exclusive for Benedictine students and alums. And the thing that you want to try to do on those is when you want to do a search for individuals who are working in the field of interest that you are pursuing. And when you introduce yourself, ideally you want to personalize that introduction saying, hi, I'm currently serving as a whatever, but I'm interested now in transitioning to working in public health in whatever capacity it is. And so I'd like to connect with you for some guidance, some mentoring or whatever. People love to talk about their occupations. People in this field really do cherish being able to engage other people, serve as a mentor, et cetera, try to kind of involve other people into the profession. But they do like that personalized introduction because it gives them more confidence that you're actually going to have some follow-up with them. And then again, it's that same manner of going about doing that, starting with kind of the informational interview and then eventually evolving into talking about where you might be able to land an opportunity for an internship or career. Okay, well, I breezed through this as quickly as I could in about 20 minutes. Does anybody have any questions right now? And again, I'll even be available after the panel are done. And I also have my contact information up there on the screen. And if not, again, I'm always available, year round. You have my contact information. So if you wanted to have a one-on-one conversation or you just want to do some email correspondence, you want me to review your resume or cover letter, you want to talk about the job search or about networking, or you need some guidance on kind of formulating that elevator speech, I'm more than happy to accommodate you and help you out with that.
Okay, Lee, it looks like we do have a question that popped up in the chat.
Okay.
Jillian is asking, is this open to alumni as well? So
yes, absolutely. Yep. Services are free and they're open to alums. Yep, absolutely. And I've had students through the years who have contacted me 20 years after they've graduated and said, hey, I need to do a change. I'm burning out where I am right now, or, I'm getting married and we're moving to live near my in-laws or whatever, and they're 2 states away or whatever, so I need to kind of act together here, or I have a new opportunity I just learned about or whatever. Can you help me putting together my resume? So yeah, more than happy to accommodate you as alum.
All right, and Jillian says, thank you so much. That would greatly help.
Certainly.
All right.
And again, everything I talked about, especially in regards to the resume, is based on a lot of the conversations I've had with students over like the last year, where they just seem to kind of lack that sense of self-confidence, because they say, well, I don't really have any relevant experience. And so I just have this one line on there that says that I'm pursuing my MPH. So that's where we try to add some of that content, really try to channel your energies and gear the content on your resume and your cover letter for the particular types of opportunity you want to pursue, always kind of nuancing it. Because what you're always trying to demonstrate in everything, in your resume, in your cover letter, in your interview, in your networking experiences, is that you're self-confident, not that you're cocky, but that you're self-confident and you're ready to hit the ground running. That nobody needs to hold you by the hand. I really want this. I'm ready to dig in. I know I don't know everything I need to know right now. I'm going to need some guidance, and some mentoring, and some training on the job or whatever. But for the most part, I can handle it. I'm not afraid of it. I'm not afraid of the challenge of it. To tackle the challenges of this field.
We also have some feedback for you, Lee. Rama says that was a great session, especially about the cover letters. She wasn't aware that we should personalize it for every position, so she does want to thank you for shedding light on that.
You're welcome. Thank you for the compliment.
And Ashley says, I will be reviewing my resume tonight, and she'll be sending it your way, actually.
Okay.
So thank you. All right. And does anyone else have any questions for Lee this evening?
Hi, I have one more question. This is Gillian. I was wondering, I may have missed this, but I just wanted to make sure for the interview portion. I recently had an interview where I thought they would ask situational questions, but they ended up having like just kind of technical questions. It was about infection control. And so I was wondering, how do you think we should prepare? Because I was really prepared on the situational side and how I should handle stuff, but I feel like it went left with that. So
that is unusual, because it really is becoming much more commonplace these days for interviews to address the kind of situational questions, tell me about a time when, or what would you do if, but that is unusual. I always say, just in terms of like preparing for any interview, I always say just you want to be yourself, so you don't want to necessarily over rehearse. There are some questions out there, for like commonly asked questions for a public health interview or something like that. But I always say don't over rehearse, don't try to memorize answers or whatever. But it's good to do some kind of preparation out loud and kind of talk through how you respond to questions. But ultimately, you want to be yourself. And so you just kind of muscle through every question the best way you can. And remember, there typically aren't correct answers to interview questions. And maybe when you're talking about technical ones like that, maybe a little bit, but for the most part, they're not correct answers. So you just try to be yourself, but it's still ideal to still at least do some preparation, ideally out loud, just so you get in that rhythm. And you're always trying to, in any interview question, you're trying to incorporate specific concrete examples to back up your response. You almost assume that they ask you and why, or give me an example. Somebody said, for example, on a scale of 1 to 10, how would you rate your teamwork skills? They're not just looking for you to blurt out a number, even though they didn't ask you and why. You assume that they did, or give me a concrete example that demonstrates why you would rate yourself a 9 or a 10 or whatever.
Okay, that makes sense. Thank you so much.
Okay.
All right, everyone, and we probably have one more, time for one more question, and after that we will head over to our panelists for the session. So if you have any questions, please put them in the chat, or you feel free to unmute yourself and ask. All right. Well, thank you so much, Lee, for the awesome presentation.
Thank you.
Thank you.
I'm looking forward to the panelists.
Most definitely.
Okay, Morissette and Ashley, I think we can start our our alumni panel. Eleni, is your screen working? There we go.
All right. Hi, my name is Ashley, and myself and Morissette will be introducing the MPH Alumni Panel.
Hi, my name is Morissette, and we have the following panelists for this evening. First, we have Rauscher, we have Tyler Holliman.
And then our panelist number 3 is Ayayi Ayite, and our panelist number 4 is Narav Shah. Thank you for being here tonight.
Good evening. Do you want me to go ahead and get started?
Yes, please.
All right. Good evening, everyone. My name is Erin Rauscher. I am a Benedictine University alumni from the MPH program. I'm also a licensed environmental health practitioner in the state of Illinois. My current position right now is I am an environmental health supervisor for the Kane County Health Department, which is in Kane County, Illinois. And just kind of how I started out my public health journey. Currently, I have over 10 years experience been working in county public health departments. I started out as a practitioner in training, which is the term used for introductory health inspector. My current role of an environmental health supervisor is to enforce code regulations on various programs in environmental health industry. So we look over potable wells, septic systems, tanning establishments, food establishments, property maintenance. So we're always looking to make sure that those programs and establishments are following the rules and regulations. Currently, I'm doing pandemic response duties and being part of our incident command system, which included contact tracing, case investigations. I was the role of a backup safety officer for the county, volunteering at our vaccine clinics and doing isolation and quarantine delivery. I am part of our King County leadership team that has helped design our strategic plans, providing data, evidence for our community health assessment and our community health community health improvement plan. In public health, we like to use a lot of acronyms. And we did get reaccredited for the National Public Health Association. So we were the first health department in Illinois to be nationally accredited. And a lot of my current focus right now is seeing how technology impacts delivery of public health essential services. We're looking into new ways to improve technology and delivering services to our constituents more effectively and efficiently.
Thank you. And next we have Tyler.
Can you all hear me? Okay, because this internet is terrible over here. Yes, so my name's Tyler Holliman. I am originally from Columbus, Ohio. As far as my background in the field of public health, I have been in the world of public health for about 6+ years now, because I actually started out as a peer health educator while in undergrad. So on campus, I was able to educate various students. internship process. So I currently serve as an outreach worker. Can you all still hear me? Oh,
You were touch and go there for a little bit. You're back now.
Okay, I'm sorry about that. What did you all hear last?
You stopped after introducing where your bachelor's degree was, where you got your bachelor's degree, and then thinking about introducing where you're at.
Okay, yeah, I'm sorry about that. This is internet. So I currently serve as an outreach worker for Columbus Public Health, and I've been with them for about 3 years now, where I work with the infant mortality initiative, serving African American mothers that do live in the low income areas. So I specifically serve 17 different zip codes. And not only am I going in to the homes, I am forming a bond and a relationship with these families. And the program that I work under is Moms and Babies First. It is a Medicaid expansion program, so it's grant funded through the Medicaid. So we serve all of these mothers, and it's a number of different aspects that tie into pregnancy as to why this particular group and demographic are suffering from so many babies dying. So as an outreach worker, I am a support for them, an advocate for them, and I am simply that person that provides them with the services and the resources that they need so their babies can reach age 1 and beyond.
Thank you, Erin and Tyler, for sharing your background. Now I will pass along to my colleague Ashley to introduce the next 2 panelists.
All right, yes, thank you very much, Tyler and Erin. Our next panelist is Ayayi Ayite.
Hi, everybody, and thank you so much for this opportunity. So I graduated from Benedictine University in 2017 with an MPH and MBA. Previously, I was a medical laboratory scientist, so I still hold that certification. Currently, my position is General Population Surveillance Fellow in the Division of Global HIV/TB at CDC. Before that, I have a couple of experiences in public health area at American Lung Association and at the local health department here in Georgia. So I basically work in epidemiology section in at the local health department, and that has helped me a long way. In my current position at CDC, I support HIV and TB prevention in sub-Saharan African country, and we have projects going on in about 16 countries currently. My work is essentially to design and review data collection tools and make sure all those data collection tools has been submitted and approved by the internal review board, and then go to the field for data collection, and after data collection, participate to the final report and publication or dissemination of the results. Basically, that's the work that I'm doing, and we can do that work depending on the phase of the project. You're doing different things or 2 different things at the same time. So when COVID-19 hit, I was deployed to the Emergency Operations Center at CDC, and my role consisted in abstracting mitigation data for all the US state and territory to evaluate how the mitigation measures are impacting the control of the spread of coronavirus. I also contributed to some scientific review for the use of hydrochloroquine and azithromycin to cure COVID-19. So I have conducted those reviews and published some of these results. That's basically my current work. Thank you.
Thank you, Ayayi. We'll have an opportunity to ask our panelists questions right after we hear from our fourth panelist, Nirav Shah.
Hello, everyone. Good evening. My name is Nirav Shah. I'm a graduate of 2010 class, 2010. I got my MPH Benedictine, so here I am. Thank you for having me here today. So I currently work at the Peace Corps office based out in Chicago. I subbed upon graduation from my PhD degree. I subbed as a Peace Corps volunteer, subbed in Zambia as a health volunteer. Currently in Peace Corps, I work on public affairs side of the house. I get a chance to work with the amazing recruitment team, promoting our Peace Corps mission on peace and friendship across the nation. So I get a chance to work with a lot of press releases, social media messaging. I joined Peace Corps back in August 2019. Prior to joining Peace Corps, I worked at Department of Agriculture, HQ in Washington, DC. I was a spokesperson for the agency, so I focused a lot on food safety side of the house, making sure people were not getting any foodborne illnesses. So I did a lot of TV interviews, print interviews, radio interviews as well, promoting food safety messages. And like I said, prior to joining the Department of Agriculture, I subbed in Zambia as a health volunteer for 2013-2015. And as part of my internship, I decided to pursue my internship in Kenya for 6 months. So I did a lot of surveillance on HIV/AIDS and malnutrition. And here I am, and thank you for having me here today.
I just want to thank all of our panelists for being here. We're going to go into the questions section. And if you have any questions, you can either unmute yourself or put your questions in the chat. Otherwise, we have a set of questions that we'll start with number 1.
Okay, thank you, Ashley. So the first question for our panelists, we'll go first with Aaron, is what is an important experience you had either during your public health education or career that has helped shape your path and interest in the field?
Definitely just to touch on most recently is the COVID-19 pandemic. Seeing how much collaboration goes into assisting with that pandemic. Through my work, one of the first things we had to address was how to protect our first responders. So our police, fire, EMTs, they had a lot of questions at the beginning, which we didn't have a lot of answers for. So it was very nervous and trying to get right information and quickly out to them since they were working with the public very quickly. Also doing other emergency responding. We've had some flood events in King County since we are a county with a lot of river towns. So we've had to deal with flooding on 2 separate years. So working with homeowners, protecting their properties from getting damaged with their wells and septics. And as far as education goes, in my undergrad at Illinois State University, I really enjoyed doing field trips, especially into different institutions. We got to go to a county jail. We went to a wind farm, a soybean factory. So seeing different avenues of public health, showing that there's so many different areas you can go into. It's not just one area. You have many different options. So I really thought that education, getting those experiences and then working in collaboration with other agencies really helped shape me with a passion for emergency management and serving the community going forward.
Thank you, Erin. Thank you for sharing your experiences through the pandemic. Same question goes for Tyler.
Okay, I'm back now. Can you all hear and see me clearly?
Yes, thank you.
Okay. So as Erin stated as well, I feel like public health is pretty much everything. Like it's everything that we do, see. It's pretty much everything. And I would say for an experience that shaped me was back in undergrad at Bowling Green was while I was taking all of my public health courses, I noticed that when it came to high rates of different health issues, African Americans were pretty much at the top. And that kind of like sparked a fire in me because I wanted to know why and figure out ways how I can make an impact, being that I am African American woman. But I noticed that when it came to the infant mortality issue, I myself personally was a premature infant as well. And I felt like during those times when my mother had me, she probably was not informed about certain situations and different aspects on how to prevent from a premature birth. So now going into the work that I do now, it's impactful, and it's a way for me to use what I have been taught and have seen, and what I did not know, that I know now, to where I can inform all of these mothers to make sure that it's pretty much a lot of different aspects that tie in to the pregnancy. It could be the outside factors, social, environmental factors, lack of education. They have their own knowledge and attitudes about certain things. They may not know the types of questions to ask when they are at those doctor's visits. So whereas someone like me that comes in as an advocate and knowing the type of questions to ask, that they're not overlooked and they're taken seriously when it comes to certain things that they may have questions about, as it does relate to the mortality issue.
Thank you, Tyler. Those were really great points that you made. Next, Ashley would be the next panelist. Thank you. Ayayi.
Yeah, thank you so much for the question. So just after I graduated, I had to have some volunteer opportunity with the DeKalb County Board of Health. And there I worked with the general population and the refugee population. So in that refugee population, where I was basically doing a case management and outbreak investigation for hepatitis C and TB from the refugee population. So the course of this work has taught me that there's a lot to learn about really global, because all these people were coming from different countries, Asia, Africa. And so I knew that even though we have a lot of hepatitis C here I live in Atlanta, but the fact that these people, the population that I was dealing with, came from other places, and hepatitis C is there, and also the TB is coming in. So I was like, okay, this is pretty interesting. It would be good to conduct this type of work globally instead of focusing in the United States. So from there, I kind of start gearing towards going global. So that's what kind of the first thing that leads me through thinking about being in global health. Then I started really looking for opportunity in global health. And when I got my fellowship position at CDC, it was in the global health, and the work that we were doing brought me to Zimbabwe, Botswana, Haiti. And so there I really found like, okay, HIV is, is real. You found people that are in the countryside, kind of, you're never gonna think about them having, HIV, and babies and people that have a high social ranking, but all of them are mixed together. You do the survey, they are HIV positive. So from there, these two experiences put together taught me that, there's something important to do in global health. And so as of now, I'm really sure that I want to be in global health as epidemiologist and a surveillance person. That's kind of how I got there. Thank you.
Thank you, Oyagi. Next, Nirav.
Perfect, awesome. So I would say definitely all my courses I've taken through at Benedictine have definitely inspired me to pursue my path in public health. I have a keen passion in global health especially. So as part of my thesis, I was inspired to do a global health study. I went to Kenya. I did a 6-month study on HIV/AIDS population there. And that kind of inspired me to do further, that kind of really inspired me to go on a journey on serving abroad, I would say. And that's when I met a couple of return Peace Corps volunteers who were serving in Kenya. That inspired me to become a Peace Corps volunteer. So upon returning back, completing my thesis, I was working for a couple of years for the American Cancer Society in Evanston, focusing on patient navigation side of the house. And that was a great work environment, but I knew my calling was in global health, and that's where I really wanted to belong. So I decided to join Peace Corps and served in Zambia, worked on quite a bit of initiatives, worked on malaria initiative in Zambia, worked on malnutrition. And like, again, the skill set that I gained was able to work in my community for 2 years. So my community members could make better health decisions while I was there. And that was honestly because of the amazing education that I had at Benedictine and the guidance that I received from the career services, especially Melissa, that really inspired me to further challenge myself to go abroad and work in that capacity. And again, even in my role at Department of Agriculture, I got a chance to use the skill sets on food safety side of the house. So all in all, the courses have really inspired me to like develop my skill set and challenge myself even further in that capacity.
Great, thank you so much. Thank you to all of our panelists for sharing your unique experiences that helped shape your path and interests in the field. The next question actually comes from the chat. Gillian wants to ask, how can we try different paths to see what we enjoy in public health? Like, what advice would you give to new graduates to find, their niche in public health? And we're going to start with Aaron.
My advice is try different internships and different jobs. You might go into an internship thinking you're going to like that certain aspect of public health, and you may end up hating it. So for your MPH, you do have to complete an internship, but don't stop yourself from doing other ones before the last one. I recommend trying as much as you can because there are so many different avenues. There are so many different organizations, different aspects you can go into. So I would definitely recommend trying different internships or different jobs, even if it's part-time or if you're doing just a project for an organization, reach out to them, see if they need volunteers. There's a lot of health organizations right now that need volunteers to help assist with projects, studies, research.
Thank you, Erin. Chris wanted to let you know that he thanks you and he definitely agrees with this. We don't know until we actually do it. Tyler, did you want to add anything?
Tyler, you're on mute.
Thank you. So what I was saying was, like Lee stated earlier, it's the networking aspect. I feel like based off my experience, I did it the old school way, word of mouth, just talking to friends and family members, people that are in my sorority. I just expressed to them what my passion was, what background I had at that time, and where I'm trying to go. So just pretty much using the word of mouth, just expressing to them what you're trying to do. And there's a lot of people that can get you there. So the old saying, it's not what you know, is who you know. So that's my take on that.
Great, thank you, Tyler. And then we're going to go to you, Ayayi. Do you think, what are ways to try different paths to find your niche in public health?
Yeah, thank you for this question. I think everything should start with the internship, either the one you have from the MPH program, or after the program, the one you will get by yourself is very important. So I'll just give my case just to illustrate this question. So when I was in my MPH internship, it was at the American Lung Association here at Georgia, in Georgia. So, and I was a health promotion intern, so working directly with the health promotion director. Then towards the end, I told her I'm interested in exploring something else with her colleagues who were taking care of TB. So the TB work that her colleague was doing is at the local health department, which is the DeKalb County Board of Health. So that's how they linked me to her, and then she brought me to the DeKalb County Board of Health. So I was curious to see something else. That brought me to DeKalb County Board of Health. From there, I start from the TB clinic. Then I was like, okay, I want to do epidemiology. Then they say, okay, if you want to do that, talk to this person. Then from there, I talk to them. They have me fill the process and everything, and they put me into epidemiology, Office of Epidemiology. And that's where I started that. Then from there, I start going to the clinic for refugee. And then, so refugee have TB and they have hepatitis C, so everything comes together. So if you want to explore, you have to be curious and you have to be open-minded, ask questions while you are in your internship, and don't close yourself up. At the same time, when I was there in the Office of Epidemiology and Surveillance, I say, well, can I see what's going on in the health assessment office? They say, yeah, sure, you are welcome. So I went there and I see how they were doing the map process. And I have been part of it, how they prepare for survey to do the health assessment in that community. That actually give me the other thing, how they are doing survey there. So that's how I was brought to begin with. And I think that's a good thing to do because it paid off. Thank you.
Thank you, Yai. That was very insightful. And the same question is going to go to Nirav. How do we, try different paths to find our niche in public health?
Perfect. Thank you for the question again. Couple of things that worked on my end is definitely follow your passion. You know yourself better than anyone else. Follow what you really like to do, what you really inspired to do. And again, you always want to make sure you do your research, right? Like the panelist said, a network, find out about the job as much as you can. see that's something really like something that really interests you. Make your 5-year plan, make your 10-year plan, and definitely go from there. And not every day will be a perfect Sunday, but then again, you want to make the most of it. And the challenges will only make you stronger. So that's something that I really believe closely. No matter what the opportunity is, make the most of it.
Okay, thank you so much, Nirav. And we have another question from the audience. The question asks, any advice for an older job seeker trying to break into the public health field? Internships are probably not an option. So we could start with Erin.
I would still look at internships just because they are geared towards graduates or undergraduates. Doesn't necessarily mean you couldn't still try, but also look into there's things like medical reserve corps that are looking for people. I would say maybe try doing a volunteer organization or a local organization in your area, searching by that, because again, local organizations definitely need help, and trying that route first because they have openings and they are looking for people, especially people in the community outreach. They're looking for people who know the area, know the people. So I would try looking in your own local community also at health organizations.
Thank you, Erin. And the same question for Tyler. Any advice for an older job seeker trying to break into the public health internships or any other?
My advice would also be to do the volunteering work and just search online for any type of organizations that are in your area. And then, as I stated earlier, the word of mouth, because a lot of people these days are very active on social media, and there are like a number of groups, of Facebook groups that you can get added to, and you can just go on there and then just express to people what type of job that you're trying to seek, and then you can go from there as well.
Thank you, Tyler. And Ayayi, you have any advice as far as an older job seeker?
Yeah, so I would say it all depends on your educational background to start with. So if you don't have like a public health background and you wanna come there, I would advise to look for a certificate of, that you don't have to have MPH to be in public health, but the best way to start is to look for short courses or certificates that are in public health area, and you have something in hand to start looking for volunteering opportunity or internship. The competition may be high with a lot of MPH graduate students that are coming. So if you don't have anything new to advocate for yourself, it may be hard. So yes, that's basically what I can advise. Looking for volunteering experience, usually around the community. You don't have to look too far. The community, the local health department, they all have volunteer office where you can reach out to people and see how to navigate through that and get your volunteering experience. That's what I can say. Thank you.
Thank you, Ayayi. And Nirav, do you have any other input for the audience member?
Yeah, definitely. You can always join Peace Corps whenever too late to serve and go abroad. Only requirements, you have to join Peace Corps, you have to be a US citizen and 18 or older. So please join Peace Corps. Your skill sets are definitely valuable serving abroad as well, and definitely marketable as well when you come back. When you complete your service for 2 years, after your 2 years, you get non-competitive eligibility. That basically means you get your foot in the door in the federal government world. You get if you want to pursue graduate school or if you want to pursue a doctoral program, we have a Peace Corps prep and covered health programs that can help you with scholarships as well. When you come back, when you come back from service, you get $10,000 readjustment allowance, and just an awesome network to be part of. And like the other panelists said, definitely volunteer is one way to build your skill set. And also, if I could add, also LinkedIn training can also help you as well with your professional grooming as well. And I'm going to put in the chat just in case anyone's interested in joining Peace Corps. You can always connect with the recruiter that handles Benedictine University. Our name is Megan.
Thank you, Nirav. So the link for the Peace Corps is now in the chat if anyone is interested. I just want to say, Melissa said earlier, volunteering is a great way to get your foot in the door and build your network. I know our panelists also advocate for volunteering. And then Aaron said, look at local libraries or community colleges also. They may have classes and short career course certificates. So if you have other questions, please put them in the chat. We're going to go to our next question. So how did you find your current job and what tips do you have for an effective job search? So we're going to start again with Aaron.
I found my current position by going to King County's website directly and to touch base on what Mr. Cruz said. A lot of organizations don't post jobs in the large career boards like Indeed or LinkedIn. So if you are interested in a certain aspect of public health, again, search those specific organizations and look at their websites, because a lot of times they won't post those jobs in the large career boards. That's how I found my current position. And then other tips, yeah, LinkedIn, Indeed are great to use. And again, networking is great to use. Try to even look at those organizations also if they have any events. Again, I know it's a little bit hard now with the ongoing pandemic, but they might be hosting events where you have a chance to network and meet people who work for that organization, or even message people on LinkedIn who work for those organizations. If you're interested in working for them, ask them about how you like working there. It never hurts to ask questions.
Great, thank you, Aaron. Did you want to add anything, Tyler? How did you find your current job and what tips would you give for a job search?
As I stated earlier, which is funny, I did it the old school way. My actual spinning instructor works for the health department, and I was just talking to her after the class and just expressed to her what my passion was and where I'm trying to go. And from there, she was able to get me in contact with the supervisor there that was in the maternal and child health department. And I was able to send off my resume that way, as well as getting in contact with my chapter. And as well as going on Facebook, they actually do have a Facebook group for women that work in public health, and I was able to go on there and just express to them what I was trying to do and what I have done so far. So that's how I was able to get my foot in the door. And I also would agree to use Indeed and even go on the health department website as well. And then you can search jobs that way.
Great, thank you, Tyler. And Ayayi, how did you find your job and what's an effective job search?
Yeah, thank you. So I actually went to Usajobs and I started Googling, I started putting the search for global health career and fellowship opportunity. So it came back with PHI, CDC, PHAP, and TMF. So many things came out, a lot of fellowship program, and by reading the stories of previous cohort, I understand that, okay, the fellowship may be the good way to get in. So I did apply for all three, TMF, PHI, and then PHAP. Got selected for both of them. You know, the process was really long, like a year process, and finally got the final offer from PHI CBC. So I guess what I can advise here is you want to follow all the instruction when you are applying to those programs, because all I've done is follow line by line the instruction on the website for those programs and do what they ask to do exactly. The only thing is the essay part of it is something you can't say, but they will give you essay prompts. And the MPH program at Benedictine University was really good because we were having, we have to, every week we have papers to turn in. So it shaped me really well in how to write paper. So that was very helpful. And that's how I got there. So the best way to do it is to start exploring. What do you want to do? You start going and exploring and then know what you have available and then start applying, following instruction. That should be good. Thank you.
Thank you, Yayi. Chris just wanted to highlight, he's also worked for PHAPS, it stands for Public Health Associate Program, and it was a great program and experience for him with exceptional students. And then Nirav also commented, good tips for searching for a job is federal government or usajobs.gov, and then he's going to speak on that in just a second. Go ahead, Nirav.
Yeah. Perfect, thank you again. So yes, definitely was the usajobs.gov if you want to work for the federal government. Yes, it's super competitive, but don't lose hope. Definitely apply. And the way I got in working for the federal government was coming back from complete my Peace Corps service, not competitive. Again, volunteerism is super important in this aspect as well. If it wasn't for my service in Zambia as a Peace Corps volunteer, I can definitely assure you I wouldn't be able to I wouldn't be here working for the government. So it just takes a while. Definitely don't lose hope, be patient. And like he said, apply and make sure you definitely follow through the application process.
Can I add something, please?
Yes. Yes, please.
So I will say for people who want to apply for federal government programs, it will be very helpful to know the resume process of federal government. It's totally different. They like a very detailed resume. They want you to write a CV and, bullet by bullet, tell them what you have achieved. And they don't worry about the number of pages your resume is. So if you really, really want to go to federal government area, take your time and you can go to Usajobs. They have a format there. You can follow that format to do your resume and make sure you put all your experiences. Don't worry about how lengthy it's going to be because that's not what they are looking at. They are looking for what experience you have, how many hours you work on that position, because they are actually tabulating to make sure you have a year of experience or whatever the requirement should be for that position. They want you to have it. So put your resume following that format and that should be great. Thank you.
Thank you, Yayu, for sharing that important tip about building your resume specifically for the federal government. And in the chat, Nirav left a link to Usajobs to give extra tips on how to build your resume. Next, we'll go along with the next question. And the question is, what courses / certifications prepares you the most post-public health education? We will switch it up this time, and we'll start with Nirav, please.
Perfect. I would definitely say my community health courses definitely inspired me to pursue my passion in public health, cultural context as well. Although I didn't like epi that much, but when I got it at my service in Kenya and Zambia, I knew how useful it was working with stats and numbers. So those are the few courses that inspired. And last but not least, an opportunity to serve for my internship in Kenya. And that opened a lot of doors for me. So if it wasn't for those courses and awesome professors and the staff in the Career Development Center, I wouldn't be able to, like I said, be here. So definitely fortunate to be able to pursue my journey to Benedictine University.
Thank you, Nirav. And Ayayi, same question. What courses, certifications prepared you the most post-public health education?
Yeah, thank you. So my certificate in epidemiology has proven to be very helpful, getting me ready to start since I went straight in epidemiology and surveillance. That was very helpful. All the tools and skills that we learned in that class, the classes embedded in the EP certificate was very good. And when I first hit the job, I had to go and take a course in Stata. It's a software, data analysis software that is used. That was very helpful because today that's all I'm using to run all my analysis for the research that we are conducting. So make sure if you want to be in EP, I will say specifically, make sure you know your software, and then the courses that biostatistics sampling, population sampling, and all the epidemiological formula, those things are very important. Thank you.
Thank you, Ayayi, for that advice. And Tyler, some courses or certifications prepared you the most post-public health education?
I would say the courses that prepared me the most were the cultural context of health and community health analysis overall. I think those were the two main courses that helped me a lot post MPH program. And then for my certificates, I actually got mine in health education and promotion. That has definitely helped a lot because I'm doing that every day. So I would say those two courses, and that has helped me a lot in my current job.
Thank you, Tyler. And Erin, courses that help you post-public health education the most?
The courses that have helped me most in my current position are epidemiology, the human resource management elective, and then the community health analysis. Epidemiology, especially because you are using data, you're doing statistics to look at population health statistics to improve population health, and we also use it for determining program effectiveness. So you're using numbers constantly. Human resource management, especially since I'm a supervisor. If anybody's planning to go into supervisory or management skills, you need to know how to coach and mentor staff, how to talk to people, how to work about disciplining people and being a good leader. And also you might be working with union staff. So that's a whole nother aspect of management skills having to work with. And with the community health analysis, when we had to write the whole community health assessment, that's very important to have strong writing skills, especially in public health departments. We do our community health assessment and a community health improvement plan. So strong writing skills to be able to write those plans is very important. Certificates, I personally, for my area, I really like FEMA. They have a lot of online free courses that you can do at your own leisure. They're self-led courses, and they have a lot of different things in not only emergency management, they talk about social media, marketing. So I've used a lot of those courses. I do a lot of continuing education that's required for my job. So I have to be up to date with a lot of laws and regulations because they're constantly changing. There's always new laws. So I have to do a lot of training in those courses. And I do use IDPH, which is Illinois Department of Public Health. They do bi-weekly webinars on the COVID situational updates. So I do that, and they do a lot of good trainings and siren notifications. So I have to be on top of a lot of laws because everything's changing constantly all the time. But those courses, and then I've used a lot of also NEHA, which is National Environmental Health Association. They have also some good online webinars or free courses available.
Thank you, Erin. It looks like we have time for about one, maybe two more questions, and then we'll be wrapping up the session. So our final question, and then we'll go to any questions in the chat if we have time. What advice would you give to someone starting out in public health? So probably someone who just graduated, entering the field. And we're going to start with Nirav for this question.
I would definitely go back on my earlier response. If you're having a difficult time finding a job, definitely volunteer, try building up your skill set. That's definitely advice that has honestly worked on my end. When I was graduated from 2010, I had a really difficult time getting a job in public health world with an MPH degree by itself. So venture out, try something different, and it might lead to a new journey. So do that, and also let's bring it back. Join Peace Corps, go abroad and use the skills that they've gained from university to help the lives of people living across the pond. So, yeah, there's always a lot of positive answers there. So that's my response.
Thanks, Nirav. Do you want to add anything, Ayayi?
Yes, thanks. I would say, it's important. For me, it's very important for you to identify your area of interest, because public health is very vast. And then once you identify your area, you can, kind of identify the skill set or extra training you need to be competent and search for a job opportunity. So once you've done those two steps, then you are really, really ready to start looking around for opportunity in local health department around you in your community. That would be very important, actually, for you to know the language to use if you get an interview. I can guarantee that if you don't have a real practical experience and you go to interview, you have a panel of people who have been doing that for years, and you coming out of school, there's no way you can really articulate the word for them to know you really know what they want you to, to do. So when you have this practical experience, then you have the self-confidence for you to go around, and when you are speaking up for the interview, you'll be talking really, really practical, and that's where you convince people to hire you. So it's very important to look for this volunteering or internship experience. Most of them may not be paid, but I really advise to take that route, like Peace Corps, like Nirav is saying it, or any other thing that you can do to learn something that will give you a clear confidence and language that you can speak at interview. Thank you.
Thank you, Yayi. It looks like we are out of time for our panelists today. Thank you so much for being with us. If you have more questions for them, please let us know. You can either contact them directly or we can send them the questions. And I'm going to hand it over to Chris for the closing remarks.
All right, I just want to say thank you, everyone. And in case I introduced myself earlier, I'm the Vice President of the Benedictine PHSO. Thank you all for coming so much. You made me feel really good about, kind of navigating public health during a pandemic. So just kind of going forward, join us tomorrow for day 3 for 2 sessions, 6 to 7 p.m., which would be session 1, which is students only for internship information with our program internship coordinator, Mary Spengler. And then the presentations will continue from 7 to 8:30 for session 2 for public health internship and career opportunities. And below, we are dropping the links for our Benedictine PHSO on social media. And as well, we do have a separate group for our LinkedIn for this specific conference. If you're interested in joining PHSO, send an email to benupphso@gmail.com. And we'll also be sending out evaluations for this conference to your email. Thank you so much.